Welcome back. It's Men's Health Month, and it's a good thing, too, because men kind of notorious for trying to push through and ignore health problems. A local organization is now holding free health fairs every Saturday, trying to make sure men get connected with the health care that they need. We're joined now by Dr. Triste Smith, the Chief Executive Officer of Near North Health. Good morning.
Good morning.
So Men's Health Month. I didn't even know that this was a thing. But it's important.
It is.
Why is this so important?
So Men's Health Month actually has been around since 1994. Near North Health has participated in this month since that time. It's very important for a number of reasons. First of all, men, their life expectancy is about 5 years shorter than women. Number two, they have really high death rates for cancer, heart disease, diabetes, and suicide. Number three, men also, as you mentioned before, are 50% less likely to actually see a doctor. And then finally, men have a tendency to culturally be very stoic around healthcare. They think that they can tough things out and wait until it's really too late, where we can do things to prevent furthering along those disease states if they come in early.
And why is that? Why do men traditionally just, like, hang back, not seek out medical help as often and as soon as women? Is it a cultural thing? Is it a biological thing? What's the difference there?
I will say it's a genetic thing, but there's fear. So a lot of people, specifically men, you kind of put things off. You feel like you can handle it and ignore symptoms because you think it's going to go away. So that's one of the reasons. Accessibility, work times, making sure that things are convenient. So once again, if you're working and you don't have a clinic like Near North that sees patients early in the morning or late in the evening, just the convenience part. Third, the affordability. So a lot of people, men included, feel that health care is not affordable, and so they're scared of whatever the cost is. Near North Health provides health care regardless of your ability to pay. So anybody who walks into our doors, we make sure that they can receive the health they need. And finally, as you mentioned, just culturally, I think men are just taught as boys to kind of tough it out. And so when we have these health fairs, it's for men all the way through boys. So boys, we try to educate them early that it's really important to take care of your health, physical and mental health.
I rushed to the doctor. I stubbed my toe. I'm like, I got to go see the doctor. So tell us about these fairs. How does it work? What do we need to know? And why did you start doing this?
So we realized that men are in a special kind of class as far as getting to the doctor. We wanted to have something that was fun and informative and had a lot of different activities. So 80% of health decisions are made by women, so most of this is actually encouraging women to bring in their sons, brothers, uncles, fathers, husbands. So we don't
go into this.
Exactly. So we have events for the men, but we also support the entire family. We have free health screenings, free food, free health education, cooking demos. We find that sometimes when we provide a recipe for lentil walnut tacos, it may not sound too good, but if you actually see it being prepared and tasting it and making sure it's seasoned, it actually is pretty tasty. So we do that. We have smoothies, we have activities for the kids, we have activities for moms. Lots of fun for the whole family.
Do men tend to suffer from diseases that are specific to just being a man that they don't go to the doctor for, as opposed to women?
So biologically, due to your body parts, yes, testicular cancer and prostate cancer.
That's an important body part.
Are two of the things that we see primarily in men, but as I mentioned before, the death rates for things like hypertension, diabetes, cancers are very much higher in men than they are in women. And suicide. So mental health is just as important in physical health, and you talked about men actually making it okay, getting rid of that stigma that it's okay to talk to someone. So at these health fairs, we also have like a men-to-men talk group where men get together without women, and they can talk about anything that they want to in the privacy of a room with other men, so they can share some of those stories and kind of help out each other.
And with strangers, that tends to be a little easier.
A little easier.
Yeah. Where can we find more information?
www.nearnorthhealth.org.
And every Saturday all month?
Every Saturday all month, starting off today at our Komed Clinic on the South Side, 4259 South Berkeley.
That's great. Well, thank you so much for your time.
Thank you
Such
for
an
having
important
me.
topic, and I'm sure it only gotten worse during the pandemic, right?
Yes, it did.
Make it better. All right, time now is 8:29 on your Saturday morning. Stay with